But we haven't finished with solutions because we have a final speaker, last but not least, Associate Professor Stefi Barna. Stefi is the Education Director at the Centre for Sustainable Healthcare. She co-founded the Sustainable Healthcare Education Network to integrate sustainability and health into medical, nursing and allied health professional education. So from an education perspective, Stefi, would you take the floor, please? And welcome.
Thank you so much, Jeffrey. I'm just delighted to be here because my journey, which began in 2008 in this area, was very much influenced by the work of Doctors for the Environment in Australia and the Australian Medical Students Association, who had put out a cracking video that I used to use to try to integrate the understanding of climate change and health into the medical and nursing curriculum. So I'm really happy to meet all of you. I've read much of your work and followed your work. I'm here on behalf now, not as an academic, but as a Director of Education at the Center for Sustainable Healthcare. I'll just say a little bit about what we do. We're a very small not-for-profit organization, been running about 12 years. We started around the same time as the UK Sustainable Development Unit, which had an inside the system way of working. We were working with just 5 or 6 people, basically with clinicians, to figure out how to innovate in decarbonizing the health system. And we've got 2 main areas of work. You can see on the right. The bottom one, sustainable specialties, is really just working with different medical specialties about what their carbon hotspots are and how clinicians can innovate. And the other is a public health area, which is currently called the NHS Forest or Green Space for Health, which has been looking at the many ways that hospitals can be involved in bringing together green spaces for the health of their patients and staff, and that green spaces can be used by general practice, mental health, in prevention and recovery. So on the left, because in this talk I'm going to focus a little bit on solutions which are a part of the secondary care system, I want to talk about the model which Francis Mortimer has designed called Sustainability and Quality Improvement, and give a couple of examples of the work that we do. So I just wanted to touch on what Nick Watts started this session with, of talking about what the NHS net zero goal is. And you can see from this, it's not very clear, but if you look at the purple part at the top, those are the changes that will happen based on changes in renewable electricity. So things outside the health system that will bring down the carbon footprint. But the lower area really are areas where we're not quite sure what to do yet. And that is where the clinical innovation will be required. So we've been focusing on this idea of sustainability and quality management or quality improvement, which is the concept of sustainable value. Instead of thinking about the outcomes for patients over financial costs, we've broadened that to think about what are the outcomes for patients and populations, and can we look at the triple bottom line of environmental, social, and financial impacts? So one way to structure that kind of thinking about what you're doing is to consider what is the main outcome that we're trying to achieve in the health system. So what we want to do is improve the health of patients and populations, but we want to reduce the carbon emissions or carbon equivalents that we're using. So there's 2 primary drivers for that. One is we can reduce the activity of the health system. Of course, you can do that by denying care to people, or you can do it by reducing unnecessary care, as we've heard about, and wasteful care. And the second thing you can do is you can reduce the carbon intensity of the healthcare activities. So if you look in the final column, I'll just start at the bottom, because most people, when they think about sustainable healthcare, they just think about estates and, you know, what is the resource use, and you've got your hospital sustainability officers who are not clinical people. So they really just look at water and waste and energy. And the other thing is to look at low carbon swaps. We heard some examples of swapping inhalers and swapping anesthetic gases. So there are low carbon alternatives for existing treatments. But if you want to move upstream and have more powerful effects, you would try to reduce unnecessary healthcare. Think of that as the leanest possible care pathways. You would want to increase the patient empowerment to care for themselves and take charge of their health, so reducing travel and dependence on testing and advice. And of course, the most powerful thing you can do is to keep people out of hospitals by preventing illnesses which are preventable. So we found this a really useful model to, when you think about what is a carbon hotspot in the area that you work and what is the area that you're working on, on what level of this system do you want to intervene? So I'll just give a couple of examples. We've been running something called the Green Ward Competition, which calls together teams and wards across a given hospital to come up with an idea for improving sustainability, the triple bottom line of their practice. And then we workshop with them to usually try to move their practice upstream from what they've originally thought of. And then they measure those three areas: social, environmental, and financial outcomes. So in this particular example, staff had noticed that a lot of patients get cannulas, but many of them are not used. And this data comes from the NHS, looking at how much of our carbon footprint is due to medical equipment. You can see on the far right of this, waste is listed, and it's just waste is minuscule compared to medical equipment use. Most people who come into thinking about sustainability start by thinking about waste, which is important, but not as effective as some of these other areas. So this is an example of the work that they did of identifying the problem. Patient presents the emergency department, they get a cannula inserted. You think about whether it's used or not. Was it appropriate or not? And then on the left side, you kind of work out what is the ecological cost of each of those steps. And what is the social cost in terms of, it could be patient quality of care, it could be patient comfort or suffering, and it can be staff well-being as well. And then what is the financial cost? So this is a kind of, the SUSQI process that we've been working with. So in that particular example, which was a very small, simple measurement, this is not academic level measurement, but they're really excellent case studies. You look at the number of fewer cannula that were used and the training that was involved, and you can see there's a little bit of money saved, there's a little bit of carbon saved, and there's an advantage for patients and staff. Another example is early mobilization. So getting patients moving, again, more rapid recovery, quicker discharge. That's one of the most powerful things you can do when you're looking at patient hospital stays, is to get them out when they're ready to go. So again, you can see some numbers here. We have all these case studies on our website, freely available for you to look at. Surgical care, there's tons of work going on. Some of it we've heard about. Operating theaters are really hotspot for hospitals, and there's many areas that you can work on in that. So here's an example from London. They've done two projects. One is switching from disposable surgical gowns to reusable, and the second is using local rather than general anesthesia where appropriate. And again, you can see the amounts saved. They're really significant in our health system, which is struggling from chronic underfunding from the central government. In mental health, we've done some interesting work on the right. You can see a quick description of the idea of, in an inpatient mental health ward, setting up weekly walks and a protocol and a risk assessment for that, and then small groups of patients and staff taking walks in nature together. And really fantastic outcomes, both for patients and staff. The cost is zero. No side effects from medications. There are all these knock-on effects of social skills and just connection to nature, which a lot of patients, particularly in inner city settings, haven't had. Another example is keeping patients awake during cataract surgery. There's really terrific work from Aravind Eye Hospital in India. You should look up, there's a really good video on the ways that they have cut back on the triple bottom line that we should emulate. But this is a UK version in which, again, significant savings in carbon, money, and patient quality. So again, just to quickly go back to, because it's very easy to get lost, at least for me, in all these examples of things. And if we come back to this model and we think, here's an example of in anesthetics, all the things you can do at different levels if you were going to do an intervention. So starting at the bottom, if you wanted to reduce your carbon intensity from operations, you would try to capture the volatile gases that are used rather than venting them out. You could look at regional versus general anesthesia, and then of course moving up, you might streamline your pre-op assessments through lean care pathways, empower patients early before they come in, and of course look at prevention. So if you work in an area and you're thinking of doing something, this is a really useful kind of sketch to start doing, thinking about what you could do. Again, in mental health, there's a whole range from prevention to peer support, recovery-based care models, the Green Walking Project I discussed, and looking at public transportation options. The final thing that we're working on is really how to integrate sustainability into all quality management or quality improvement work that's going on. So we are hoping to establish SUSQI academies in all regions and countries of the United Kingdom and provide an accreditation process, again, working on some of these triple bottom line ideas. Any of these ideas we would be more than happy to share with those who are interested, and anything you can pick up from our work and use in the Australian context, we'd be delighted to share it with you. All the materials about sustainability and quality improvement are available on this website. We also have networks of peers who are talking to each other, posting things. Has anybody tried to do this? Can you give me some advice? You can see there's a whole range of specialties. We offer some short courses where we kind of do bespoke work with you on the projects that you're interested in. We've had a number of Australians commission short courses from us to develop that. And so basically, in short, we've developed through partnerships, and we'd be really happy to share everything we have and work with you. Thank you.
Stefi Barna, thank you very much indeed. And thank you for the steak knives at the end. It looks like there's lots of free stuff there. So fantastic. Thank you very much.